This is the catheter care skill. The supplies that we're going to be bringing into the room are a barrier, gloves, a bath blanket, a towel, and 2 washcloths. Let's begin. Hi, Alex. My name is Cindy. I'm going to be your CNA today. I'm here to clean your catheter. Is now a good time? She says that it is. So I'm going to put my supplies down, starting with my barrier. Next, I'm going to sanitize my hands, rubbing until dry. And then I'm going to close my curtain for privacy. I always have to make sure that I lock the bed breaks. I'm going to put on my gloves right away. And then I'm going to put the bath blanket on. And I'm just going to put it on the upper part of her body to keep her warm. When I come back with my water, we're going to pull that sheet down. Next, I'm going to get my basin out from the cupboard. I'm going to put the soap down. I'm going to go to the sink. Using a paper towel, I'm going to turn on the water. And I'm going to adjust the temperature. I'm going to hold on to this paper towel and I'm going to use it to turn the water off. Whenever I work with water, I bring the basin back and I ask my resident to check it. Alex, can you check this water temperature and make sure it's okay? She says, that feels just about right. I'm going to put my basin over here. I'm going to move everything around in my workspace so that it's within easier reach. Now that I'm not going to be leaving the bedside for a while, I'm going to put her bed in a higher position to about my waist height. I would not have done that before I got my water because I wouldn't want to put her in an unsafe situation. I'm going to move her call light. And I'm going to ask Alex to hold on to her bath blanket while I pull her sheets down just to about her knees. Now I'm going to flip her bath blanket up and her gown, and I'm going to expose her from the hip to her knees only. If our resident needs to have their legs frogged, then we would. But for this skill and this resident, we can see everything just fine without frogging. We have to make sure to never pull on this catheter at all. And we do have catheter safeties that we have to go over. So the first thing, the 4 catheter safeties, the catheter is intact, it's over the leg, not under, the extra tubing is coiled, and the entire catheter is secured to the bed frame, never anything movable such as a side rail. So that's in place, and I have to be very careful here. I'm just going to put I think I will frog her leg just a little bit on the one side. I'm going to put this towel for drying right here in the middle, and then I'm going to pull the sheet up to her knees, and I'm going to push it down just so that you can see what I'm doing. Next, I'm getting my washcloth wet, and this one is going to have soap on it. So I'm going to wring it out. I'm going to unfold it completely, and I'm going to put soap on all surfaces, front and back. Then I'm going to fold this up into my washcloth onion. I have to wash this tubing 3 times, and it's important that I hold and secure the catheter right here at the opening, which is called the meatus. I'm going to use my 3 other fingers to anchor this catheter in place so that I don't tug it at all. Next, I'm going to take my washcloth with my first clean surface facing up. I'm going to wrap this around the tubing. Do you see that? Wrap it around the tubing. And I'm going to make sure not to pull this, but with friction, I'm going to wash about 3 or 4 inches down the tubing. That's my first one. Let go of the catheter. Change surfaces. Again, I'm going to secure it at the opening, anchor with my fingers, go underneath, and wash 3 or 4 inches down with friction. change surfaces, and I'm going to do my third and final wash. I'm securing, I'm anchoring, and I have to wash 3 or 4 inches down that tubing. I'm done with my wash. What I wash, I rinse. So let's get our rinse towel, wring it out, fold it up into my washcloth onion, and again, secure at the meatus and secure with my other fingers. Wrap the washcloth around with friction 3 to 4 inches down. That's 1. Change surfaces. 2. Change surfaces. And 3. Change surfaces. I'm done with my rinse cloth. What I wash, I rinse. What I rinse, I pat dry very carefully to not tug at all on this catheter. And I have to dry the catheter itself. Her perineal area got a little bit wet, so I was drying that too, but you have to dry that catheter. When we pull this towel out, we have to be so careful not to catch on that catheter because we can never, ever tug on it. I'm going to help her unfrog her leg. Everything's still right with my catheter. I'm going to pull down her gown, and I'm going to pull this up. I'm going to ask Alex to hold on to the sheet while I remove her bath blanket. I'm done with all of my dirty supplies, so I need to walk away from the bedside. I'm going to use my knuckle to lower the height of the bed. I'm not going to walk away from her to empty my water basin with her in a high position. Next, I'm going to the resident's bathroom. I'm going to dump my dirty water into the toilet or the commode. I washed, rinse, and dried my resident. Now I'm going to wash, rinse, and dry my basin. My wash water goes in the toilet or commode. My rinse water goes in the toilet or commode. I'm shutting off the water with that paper towel, and I'm getting a clean paper towel to dry my basin. Walking back to the resident's bedside, I'm going to put the soap inside the basin and put that away in the drawer. My last dirty supply is my barrier. Let's move things around to kind of straighten up the resident's room. I'm ready for my hand wash, so now I need to take off my gloves. I'm going to hold my hand like this to create a little bit of slack, and I'm going to go dirty to dirty. Wad that all up, clean to clean, and I'm going to flip this upside down so that my gloves come off inside out. I'm going to put these gloves in the trash. Now I have to do my evaluated hand wash using a barrier to turn on the water, adjust the temperature. That feels about right. My hands are going in, my fingers are spread, pointed down. In, spread, rotate, pointed down. I'm going to drip. I'm going to get 3 pumps of soap on both hands. Wash the wrist, the back of this hand down to the fingertips, the back of this other hand down to the fingertips. I'm going to wash the palm of both hands. I'm going to do each individual finger rotation with my fingers pointed down, making sure not to touch the sink with my tummy. Next, I'm going and washing each cuticle on each finger. Next, I'm going to scratch the palm of my opposite hand with my fingernails and scratch this side with my fingernails. Next, I'm going to clean underneath each individual fingernail. My fingers have to stay pointed down. I'm not touching the sink with my tummy. I'm ready to rinse, and my wash had to last 20 full seconds. I'm rinsing with my hands in, my fingers spread, and I'm rotating at the wrist. Drip, drip, drip. My first paper towel, start at the fingertips and work your way up and put that in the trash. My next paper towel, I flip my hand over from fingertips up to the wrist. Third paper towel, fingertips up towards the wrist. And one more paper towel from my fingers up to my wrist. I'm using another paper towel to turn the water off Don't crumple it, put it straight into the trash. My evaluated hand wash is done, so I'm going back to my resident's bedside. All I have left is my safeties, my 3 L's, confirming that my brakes are still locked, the bed is still in the lowest position. And Alex, would you like your caulite in your right hand? And she says that would be fine. Now I take a moment and kind of figure out if I have any corrections that need to be made. If so, I can make a correction at any time, but I think I'm doing all right. So I'm going to open my curtain, sanitize my hands, rubbing until dry, and then I'm done.